Hello everyone, greetings from Shishu, a space where we discuss everything related to our little ones. In continuation with my last breastfeeding videos, in this video I will discuss and address the common medical concerns which the mother have while doing breastfeeding. The common medical issues which usually the mom face during breastfeeding are flat or inverted nipple, sore nipple, engorged breast, sometimes leading to breast abscess and not having enough milk. Now coming to the flat, short or inverted or retracted nipples, there are many types. We need to check whether you are having a flat nipple or an inverted nipple. Now first you need to identify, in case of a flat or a short nipple, it is not difficult to breastfeed a baby because they are just flat, and once you pull them out they usually come out and the baby is able to breastfeed well. Only in cases of inverted nipples that the latching of the baby to the breast is difficult, but with little time and patience it is not impossible to breastfeed a baby with a flat or an inverted nipple. So I'll let you the ways how you can assess and then what you can do to address this issue. First you need to examine yourself whether you have a flat or a short nipple or a inverted nipple. Now examine yourself and place your index and thumb behind the nipple and just roll your fingers on the areola, the black part behind the nipple. If the nipple comes out, that means it's just short and retracted nipple. But in case of flat or inverted nipple, it will just go back inside the breast tissue and it will not come out. So this is something which needs to be taken care of, because this is something which causes a problem in latching of the baby to the breast and in successful breastfeeding. And I would say this is something which should be examined and which should be you should be able to find it out during the antenatal period, so that you can take measures to correct it when the baby is born. So what can you do to take care of this problem? The number one is use of a nipple puller. Now nipple puller is a small suction device which you can use to pull out your nipples before the breastfeeding. So when you have a breastfeeding time, just before that you need to apply the nipple puller on the breast and do 4 to 5 squeezing actions so that the nipple comes out, and then you latch the baby to the breast. In case of short nipples or retracted nipples, this is something which usually helps most of the moms and nothing else is usually needed. Now there are nipple pullers available in the market. I will show you. This is one which is available in the market. Easily you can find it in any baby shop or a chemist shop. So you have to apply this part on your nipple and then you have to squeeze like this. So it will apply some suction pressure so that the nipple comes out in case of short or a retracted nipple. So once the nipple is formed, then you guide the baby to the breast and help in breastfeeding. Now the similar nipple puller, if it is not available or you are somewhere where you don't find a nipple puller, so we Indians, we are very innovative and we usually find an indigenous solution for everything. So in that case what you can do is you can take a 10 ml syringe. So this you would easily find in any chemist shop. What you need to do is just take out this plunger. You need to cut the front end like I have done, like this. You have to remove this and then use the plunger to insert this side. Now from this side you have to apply this to your nipples, and now you can use this suction pressure, whatever is comfortable to you. So you can guide yourself how much pressure is convenient for you. You can use that. This will help in forming the nipple. So this is kind of a suction device, kind of a indigenous nipple puller which you can make at home if the nipple puller is not available. So this, if done before every breastfeeding session, will really help in case of retracted or short nipples. In case of flat or inverted nipples, ideally this suction should be started, the suction with the nipple puller should be started during the antenatal period, preferably from 3rd trimester onwards. So every day the expecting mom should do this thing every day in the morning or maybe once or twice a day. So apply it on the nipples and do it 5 to 6 times. So gradually, if done on a regular basis for few months, it will help in formation of nipple and in establishment of a successful breastfeeding post the delivery. What else can you use? You can also use a breast pump to apply suction. Then there are also certain devices in case of severely inverted nipples or very flat nipples. There are nipple retractors or extractors which are available in the market, which need to be worn on the breast during the antenatal period, especially in the last trimester, so that by the time the baby is born, the nipples are little formed and it helps in latching of the baby. Now, what else can be done when you are feeding the baby? Once is using this. Now, this is using a nipple puller. Another thing what you can do is you can also do it with your hands. With your index finger and thumb, you have to gently roll the nipples between your thumb and index finger like this. Usually in case of little retracted or short nipples, this is something which also helps in forming the nipples. So just before latching the baby, just do this 5 to 6 times. It will form the nipples and then you can latch the baby to the breast. So another things, when you are feeding the baby, there are certain tips which you can use which will also help in establishment of successful latch and breastfeeding of the baby. One is Nipple Shield, which is available in the market. In case of flat or retracted nipples, you can apply a Nipple Shield. This is kind of a silicone shield in the shape of a nipple, which you can apply over the breast. So this usually helps initially. For some time it can be used because it helps in the baby latching onto the breast, and sometimes it's also used in case of sore nipples so that the pain decreases. But somehow in my clinical practice, I have found that it is not that helpful and the use is also controversial. But yes, it can be tried if it is comfortable for you and your baby. Other things is you can also push when you are feeding the baby. You can push your breast tissue behind with your hand so that the nipple comes forward. This also helps in successful latch of the baby. Another thing which helps is a C-shaped or a V-shaped hold of the breast. Again the purpose is the same, is to make the nipple and the areola part prominent, to form it in the form of a conical shape. Like when you do a C-shape hold is like this, you hold your breast like this so that the front part is little prominent, which helps in latching the baby. And the V-shape is you hold your breast between your fingers like this. This is a V-shape hold. So all these things, if work together and you are motivated, you are not anxious, will help ultimately in successful breastfeeding. Above all, the family support is also very important. And still, if you feel that you are having a lot of pain or the baby is struggling a lot, please seek a help of a lactational consultant or your doctor to help you practically in and guiding you how to do it, because breastfeeding is something which is the birthright of every newborn. I hope I am able to address this issue properly in this video, and expect that it will solve most of the issues related to flat or the short nipples or retracted nipples. Till then, stay safe. Goodbye.